Nigeria and maybe other parts of Africa. It's a great privilege for me to be here this afternoon to make this presentation. Like Dr. Stella said when she was introducing me to the Vice Chancellor, Dr. Stella is, I call her my senior and my mentor. And just like she said, I took a decision on the graduation floor when she was graduating from Lagos State University with her PhD. And I said, I'm going to give this a shot. And I've been on it for quite a while. We were involved in Cottage of Hope Together, an NGO that uses education as a tool of rehabilitation for prison inmates in Nigeria. And someone who asked me, you have this, you have that, why go into clinical mental health counseling? Based on my experience and observation while working with Nigerian, used to be prison systems, they're now correctional systems. We found out that there is no single clinical mental health counselor in the whole of the Nigerian prison system, where they have a couple of psychologists in some of the prisons. And my motivation then was like, okay, let me come into this country, acquire this certificate, get some experience and go back home and start a halfway home, because we found out that the rate of recidivism was on the increase in Nigeria, and the absence of a halfway home that will help the inmate to transition from prison to the society is one of the major causes. So that's why I found myself here with as a clinical mental health counselor. So the topic here today is talking about extending the frontiers of mental health care in Africa, exploring digitalization. The issue of mental health. Well, I might be saying some things that might not be in the slides, and I hope I'll be able to do this within the few minutes that I have. The issue of mental health care or mental health challenges is in a state of crisis, not only in Nigeria, but also globally. I just started working in the field, in a mental health hospital. And it's so alarming, the rate at which people or individuals are admitted into mental health homes. Well, it's not only about mental health hospitals. Everyone, and I make bold to say this, every one of us have one or two mental health conditions. It's just that maybe we have not been diagnosed. And the current global situation and circumstances has put so much pressure on individuals that some are at the breaking point. So having this conversation, especially when it comes to Africa, is such an apt time. My only hope is that after the conversation today, we might be able to take this further and not just make it like a talk show, but what are the actions that we're going to take. Can you give me the next slide, please? So thank you so much for coming and listening to me. I appreciate it so much. I hope we'll be able to gain one or two things. Now, like I said, situation report. Mental health body is growing speedily across Africa, and some of the reasons are not far-fetched. Most countries in Africa are going through economic downturn, political instability, insecurity, and all these things, factors impact negatively on the mental health, of individuals. According to the World Health Organization 2025, over 150 million in Africa has one or two mental health challenges. Because I like working with data as a researcher, I want to say that even this is, we don't have enough data. And for those of us that are from Africa, you know that the issue of stigmatization the issue of acknowledging the fact that, oh, I have a mental health concern. Because mental health is concern is different from mental illness. But a lot of people immediately hear mental health. They're talking about, oh, that guy has gone psycho. Not necessarily. So this figure itself can be controverted. According to World Health Organization 2023, again, over 85% of people do not have access to formal mental health treatment. For example, some people believe, like Dr. Stella said, I am a Christian. I don't like carrying titles. So I don't have a problem in being a Christian. We find out that people that even have mental health issues in Africa, they either take them to some white garment churches and chain them and all that and all that. So again, situation report, we have high stigma and low access in rural communities. However, looking at the challenges, there are also possibilities when it comes to the use of technology. Now, statistics also shows that 80% mobile phone penetration, which results in new possibilities. The rate at which people are having access to mobile phones is on the increase. You cannot compare the population of people that have access to mobile phones. So in 10 years back to now, so what it means is that with technology, we can push forward access, affordable, let me use the word, affordable mental health services, even to the most rural aspect or most rural segment of Africa. Can you give me the next slide, please? Thank you. Now, what are the common health challenges in Africa? Depression, anxiety, substance use disorder. This, especially in Nigeria, the rate at which people, I did a study with someone and we're looking at the rate of substance use in South Africa. Then we went globally. We find out that the rate at which people are using substance has been on the increase. And this is also a fallout of the fact that people are going through so much and they want to take one or two things that will make them feel relieved at a point in time. Again, suicide. While we were growing up, it is a very rare occurrence to hear about suicide, but it is now a common feature, even among young people. Then alcohol use disorder. It's important for us to identify some of these common health challenges so that we'll be able to know, even if we want to digitalize, what are we going to look? What are the symptoms? What are the things that we are looking at? Give me the next slide, please. Now, this is also giving us some form of data. Less than one psychiatrist per 100,000 people when compared to 10 to 15 high-income nations. That is talking about positive death of the number of psychiatrists. The last figure we had in Nigeria, for example, there are less than 500,000. No, there are less than 500 psychiatrists for a population of 250 million. Again, there is wide disparity in access to mental health services between rural and urban communities. The reason for this is not far-fetched. Then the attitude about mental health issues remain negative. I was talking to a colleague at work and I said, back in Nigeria, if somebody has maybe like psychosis, schizophrenia or whatever, the family itself does not even want to associate with that. Unlike here, I've seen parents call on the hospital, how is my son doing? Yesterday, I had a conversation with the father at about 6 o'clock, asking about his son in the mental health. Stigma remains high and there's no level of awareness. And when there's no awareness about mental health, it's going to be difficult to have what is called digitalization. Another important factor, which could be used as an asset, is that yes, Africa's population is growing exponentially. But the beauty of it all is that majority of those in the population, in our population, are the young ones. And these are the ones that have access to internet services and telephones and all and other gadgets. Can you give me the next slide, please? Now, telehealth or digital mental health. This is a great opportunity to employ technology to improve, to provide mental health care services. This is called telehealth. We don't need to have an in-person, therapy sessions or intake or assessment. Due to digitalization, we in Africa can begin to operate using telehealth or providing health services, mental health services digitally. This includes some of the tools that can be used include teletherapy, SMS-based support, mobile apps, and chatbots. Again, digitalization of mental health in Africa can enable privacy, affordability, and a wider reach. Then we have some examples. There's an organization in Uganda, although they are focused mainly on women that have mental health, especially area of depression. They call them in Uganda, and they have been able to reach even the most rural areas of Uganda due to digitalization. Then there's another one called Shine Project in Kenya. I hope that very soon we'll also be able to reach out, be able to do some of these things in Nigeria. Give me the next slide, please. Now, what are the infrastructural deficits? Limited broadband and internet reliability. I relate and talk to a lot of people back in Nigeria, and some of them, even family members, you find out that some of them do not even have internet access. Not that they don't have data on their phone, but there's no connectivity because there is limited broadband and lack of reliability of the internet. Expensive cost of procuring devices and a high cost of buying data. I have a friend who complained to me that he's not been able to talk to me for close to a week because he bought data that he was not able to use and the data expired. Not only do we have issue with the availability and the reliability, they are also very, very expensive. So if you want to do telehealth or you want to digitalize mental health in Africa, there's a need to work around this infrastructural deficit. Recurrent power outages. One of the reasons the providers give is that they themselves do not have access to power. They run their engines and all that on diesel. Now, even if I have a device at home, whether it's a computer, whether it's a phone, and I want to have counseling session or therapy sessions, and I don't have power to charge my device, there's no one going to be able to offer such services. Or somebody that wants to receive service and do not have power. Low digital literacy in some parts of Africa. Even some of us, I remember somebody telling me that she's BBC. I won't mention the name of the person. That is born before computer. A lot of people carry or they have in their hands high quality mobile devices, but they do not have enough information on how to use it. So these are some of the infrastructural deficits. Give me the next slide, please. I think I'm running out of time. Now, what are some of the innovative digital solutions? We can have what is called SMS-based counseling for non-smartphone users. That is, some of them may not have access to maybe Zoom, Teams, and also let me quickly say this: the various the platforms that we use is also limited because it's also a matter of confidentiality. When it comes to professional practice, we are limited here in America, I don't know about Africa, to certain platforms. For example, some of the organizations that I know, they can only use Teams Some don't even use Zoom that we are using. And it's to be able to protect the information of clients. Well, some are also saying they can use WhatsApp or voice call therapy. We can also use, trying to be innovative, solar-powered community telehealth hubs. Again, how many communities in Africa can afford solar-powered telehealth? Then we also have what is called a hybrid, in-person and digital models. They are beginning to emerge all over the world. Well, one of the benefits of COVID is that during COVID, a lot of people moved digitally, virtually, and that's how telehealth also came about. But now we are back to normal. And for me, if you ask me as a professional, I would rather prefer an in-person. But in a situation whereby maybe due to distance, maybe due to cost, and a client is not able to attend sessions and they have access to device, why don't we use an innovative digital solutions? So we can also have what is called a hybrid, that's in-person or digital models. They are beginning to emerge in Africa. Next slide, please. Now, some of the collaborative efforts that are going on is what is called Mind It in Africa, telecounseling training, 9 mobile telehealth in Nigeria, phone consultations. Then we have some non-governmental organizations that are collaborating for online therapy. There's also this organization, World Health Organization, collaborating with Africa e-health strategy to support digitalization of mental health treatment. Next slide, please. What do we need to do? We need to work on policy and capacity building. We need to integrate mental health into national e-health plans. Let me say this very quickly. In Nigeria, as of today, there is no law or regulations that protects or provides or that enables mental health in Nigeria. Sometimes I think it was the 8th or the 7th Senate. One Senator Adie was trying to push for a bill to establish, but that thing has not seen the light of day. So what it means, which is happening in most cases, I know someone who is just pursuing a PhD in a university in Nigeria, and she's calling herself a counseling psychologist. Those are some of the barriers that we have. Now, there's a need to also expand telehealth regulations and data protection. If I know that my information is protected, my privacy is protected, confidentiality, or I would be interested in making myself available for telehealth training. But if this is not, I have a conversation with the therapist, and what I discuss in confidence with therapists is all over the social media. That is demotivating. We need to include tele-mental health in counselor education. I didn't do enough research, but to the best of my knowledge, we cannot even be talking about digitalization if we don't even have professionals, qualified mental health professionals. I'm not talking of quacks that will be able to provide these services. So in trying to see what can we do moving forward, we need to include tele-mental health in counselor education. We need to incentivize telecoms to offer low-cost data for health. Well, some of these things look as if they are not possible, but I believe in the fact that let us make an attempt first. Because if you look at some of these suggestions, we find out that they are relevant and germane. If we want to increase mental health treatment or mental health care to as many people in Africa as possible, then we need to look at these things. Can you give me the next slide, please? The next slide. One of the things that is also important is there is a need. I don't know whether this is relevant. When I first came to America to study clinical mental health counseling at that university, I was trying to see if there could be a technical relationship, like a kind of collaborative relationship between the university here and some universities in Nigeria. Because as I'm talking to you, I'm not sure if I stand to be corrected, if there's any university that is offering clinical mental health counseling. I've been in counseling psychology since my master's degree program, and I've also held positions especially in Lagos, for the association, Counseling Association of Nigeria there. And I have not seen any area of specialization that is talking about mental health. So what we just have is just generalization. What I'm trying to say in essence here is that there's a need to also begin to develop. There's also a need to develop curriculum that is relevant to Africa. We don't have enough time, but I've gone to talk about that as well, because some of the concepts that we have is foreign. And even here in America, we are saying now that some of the inventories, some of the assessment tools were normed based on the white population, not taking into cognizance the culture, the background of the minorities, of the Black Americans, of even naturalized Africans, because the characteristics of a white man is totally different from that of a Black man, that of a Native American. So there's a whole lot to do, but I believe that 1,000 steps starts, the journey of 1,000 miles starts with a step. So is that okay? Now the future of mental health care. There is a need growth for AI chatbots for screening and psychoeducation. Yes. Local language applications and culturally adapted content. Now, what I've said that a little before, but let me quickly explain it again. Now you have what is called, let's use this one, intelligence quotient tool. And that tool is designed, before what we call it instrument. It is also pre-tested and post-tested. And the characteristics and everything, even the way the questions are designed, are specifically for the white population. Now you now take that and go and administer it to an African with a different background, different culture, different everything. And you now say the guy has no intelligence. No, we have to have cultural relevant assessment tools as well as local languages. When you say some things in English, there's a loss of the meaning, the content in original. And that's why in mental health counseling now, they are teaching us to be more culturally competent and relevant. Blended therapy, digital and community-based. We need to involve the community if we want to have digitalization and even effective mental health treatment. Emphasis on ethical, inclusive access. In as much as I'm not running down Africa, in as much as I'm not running down Nigeria, we do not adhere strictly to some ethical consideration. I was talking to somebody in the office yesterday, and he told me point blank that I need to be very, very careful. That everything I do must be documented so as to protect my license. My question is, in Africa, in Nigeria, who is regulating what? Online, somebody that was a mental health nurse calling herself a therapist in Nigeria. That cannot happen here. If you want to go digital, if you want the horizon of mental health care in Africa to grow and meet the needs of the people, there's a need for us to develop ethical principles. And let's also have what is called inclusive access. Not that, mental health is only for some kind of people. Let it be all inclusive. Yeah, do I have another slide? I'm sorry I've taken so much time. In wrapping up, digitalization lendings, it does not replace human care. For someone like me, Yeah, okay, we can reach as more people using digitalization, telehealth, and all that. Of being an African and a typical Yoruba man, I still believe in one-on-one. Yes, we want to go digital, that's okay, but that is not a replacement for human care. So what it means in essence that even if I'm providing telehealth, I must still make sure that it has the human element. Infrastructure limits creativity and not innovation. We have spoken about the various challenges that we have with infrastructure. You might limit the way I do things, but it should not limit my innovation. The way forward again is with collaboration, working together as a team. We can sustain what we have gotten. Now we have a question. How can universities facilitate digital mental health innovation? In this part of the world, universities drive research. Universities drive innovation. How many of our universities in Nigeria have the resources, both human and other resources, to drive mental health innovation? But we cannot say because right now we don't have. Some people might be on this platform and say like, okay, I'm going to take this up as a challenge. I'm going to take this up as, and we can move forward from that. I think that's the last slide. I've taken almost 30 minutes. I'm sorry. I talked too much. That's one of my problems. So these are some of the references that we use. Thank you so much for the opportunity.
Wow. Amazing. All right, please go ahead, Prof. I think you want to say something.
Me?
No,
Oh, Prof.
Oh, okay.
Oh, I thought Professor Stella wanted to say something. All right.
Oh, okay.
So, yeah, what an amazing presentation. Thank you so much, Double Dr. Oluyemi. For me, so before we go ahead to, take questions or maybe comments, why we'll prepare for that. So if you have questions or you have some comments to give, you can just signify by raising your hand, using the reaction, using the reaction option or the reaction feature available on Zoom. So thank you once again, Dr. Oluyemi. And for me, I think this presentation gave me a moment of reflection and, to think back into this problem of mental health, right? And also how the digital transformation plays a huge role in scaling up solutions, mental health solutions, right? So for me, I see mental health, right, and I see how digital transformation or digital technologies can help us, scale or reach the unreached. So it's very important. It's very important, right? Because I have a friend, I have a friend who is a mental health practitioner, right? And I understand how digital technology plays a huge role in our work because there's someone in Nigeria who has clients almost across the world, right? She's almost every weekend, every Saturday. Her name is Fifi Feromi. I'm quite maybe always around her. I see her talking to people maybe from the US, from maybe South Africa, helping them to come out of their problems. She wouldn't have been able to do that without digital technologies, right? So digital technology plays a huge role, and I want to appreciate you again for pointing out all of these things, and from policy standpoint, from university having to engage in innovations and all that. Yeah, so thank you so much. So we have Dr. Chima also. I think um, she has a question for you. You can go ahead, please. Yeah, doctor, you can go ahead.
Yes, mine is both a question and also a comment. Everywhere I turn these days, I hear about mental health. This presentation made mention that I'm driving, so I really need to stop. And this presentation made mention of each and every one of us having a degree of mental health, will I say, phenomenon. Because I don't want to, he distinguished between mental health issues and mental health illness. Ours may not be to the, may not have come to the level of illness. But I think it's time for us to pay greater attention to mental health questions. One is he mentioned something about assessments, tools that are used in learning, teaching and learning related to mental health. So my question will be, what will be the best strategy to make sure that this mental health issue or phenomena will become part of established curriculum or curricula in our various institutions? Yeah, he may not have the answer, but it's time for us to make suggestions, and connect dots regarding organizations we know that are involved in mental health solutions, mental health epidemiology and pedagogy. Since this is an academic environment, we had to throw in some of those things so that we can apply them in research and solution-based approaches. Thank you. My name is Chima Wosu.
Yeah, so thank you so much, Doc. Oh, okay.
Doctor. Yes, please go ahead. You can answer
thank you so much, Dr. Chima Wosu. You've made a very great point. When I said that we all have mental health concerns, sometimes we have a misconception of what it is all about. Let me give you an example of myself. I just started a new job and new environment. It's not an environment that I actually want to work, but because of certain things, I just have to do it. It's a mental health hospital. And I found out that my level of anxiety has increased because of the nature of the work. Yes, on Thursday and Friday, in fact, I witnessed that of yesterday. Patients started fighting one another, that they had to hit two nurses. And the nurses were crying, they were women. That incident happened about 1 o'clock, and I started developing headache. But I couldn't leave work until 5:45 yesterday. So for me, my level of anxiety has gone up. I have not checked my blood pressure. Maybe that also has affected me. All these things combined together. You are in traffic for how many hours? Your finances cannot meet up the expectation. Children's demand, school demand, work demand, all this put pressure on us. And it can, from anxiety, turn into depression. Or I know that a lot of people say, that's not my portion. I was talking in a church last week, Saturday, and I said, this thing we are talking about emotions. I'm sorry, I'm not trying to be spiritual here. Even Jesus Christ felt emotions. He wept. He was hungry. He was tired. He slept. So we need to, I agree with you, ma'am, that we need to pay more attention to it. With regards to curriculum and all that, again, I remember Professor Akimboye of the University of Ibadan, Department of Guidance and Counsel. He said, even in a desert, plant a flower. Like you said, we need to begin to connect the dots. I have spoken severally on mental health. In fact, there was a platform from University of Johannesburg. And we had a wonderful session like this. And everybody was like, what do we need to do? What do we need to do? Let me shock you. All the excitement and the conviction and whatever died after the program. Nobody connected with anybody after that. So we need to begin to be more deliberate and intentional about this. This university can decide to take the bull by the horn. What can we do? Thank you so much.
Awesome. Yeah, thank you so much for that answer. So we have the next person, Dr. Okido. Yeah, you have the floor, sir. Dr. Udo.
All right. Thank you very much. I prefer calling you Professor Yemi. This is actually not only insightful, it's persuasive and inspiring. I've actually, especially when it comes to the issue of mental health, there's a certain question always asked. Does one environment determine who is mentally derailed? Environment, generation. Okay, let's say for instance, I remember while we're growing up, there's how you would dress. People maybe run around or pursue you. They say you're either having what we call a banje. That's the highest level of a mental problem. They will say maybe spiritual. They say you have a banje. But now people are dressing that same way, and nobody cares. And so sometimes I begin to, even the environment, I remember when I was pastoring a church in New Jersey. I remember during summer, people that used to dress with suit, but during summer, I see some of our girls that I thought they were very committed, coming with what I can call pant, coming with something that pant to church. So that was the area of environment. And also generation. People, the way people behave now, nobody, anything goes. So what I'm asking, does this mental challenge, is it a function of generation, also environment? Thank you, sir.
Thank you so much for that question. I agree with what you have said. The environment plays a significant role in our mental health condition. Let's look back at, I know some of us have been here for years. The kind of issues and challenges that you face in Nigeria is totally different from what you face here. Whether it is for negative or positive, the environment has a lot of impact on everything that we do. Even there's a theory that is called nurture nature. What that means is that nature has some, how I was born, where I was born, my genes, my chromosomes and all that, those are nature. Sorry, yeah, those are nature. But when I get to the environment, let me give an example. A monkey was born and brought to live among human beings. A human being, a young baby, was taken to the den of monkeys. After some years, I'm not sure of the number of years, they now brought them back, changed their habitat. A human being that was living with monkeys, when he came back to human settlement, was behaving like a monkey. And a monkey that was brought to the midst of human beings started behaving like a human being. So the environment is a function of so many things that happen to us. We are talking about the issue of dressing. Yes, that's part of the culture. And this culture evolves. It's not static or stable. I don't want to go into the issue of church about dressing and all that. In counseling or mental health, for example, we say, well, that everybody has what is called autonomy. Take a decision that you want to take. Now, when it comes to also the issue of hereditary, when an assessment is being done about somebody's mental health condition, this could even be stress, anxiety, emotional, low self-esteem, and all that. Questions are always asked. In your family, has anybody had the history of, let's say, anxiety or whatever it is? So in some cases, you can be able to trace, and research has shown that there's a tendency, just like in medicine, for someone in your lineage to have had mental health concern. When such questions are asked during assessment, is to be able to see whether there is a trend in the family, just like in physiology or medicine. There's this belief that, not belief, it's founded empirically, that if, for instance, somebody in somebody's lineage has history of either hypertension or diabetes, there's a likelihood that out of 10 of offspring of such people, 1 or 2 of them will have the same thing. So the environment, it's a great determinant. For example, somebody that has been living in the prison, the condition of the prison will condition him into certain things. Here in this country, they said it's an individualistic kind of stuff, lifestyle. That also will shape the mental health, total well-being. Let's use the word total well-being so that we are not limiting it to mental health. It's a whole package. And that's one of the reasons why we need to, as individuals, just as we check our blood pressure, just as we check our glucose level, there's also a need for us to check the state of our mental health. I know a lot of people say, there's nothing wrong with me. The mere fact that you have gone to go and assess yourself mentally does not mean that you have mental issues. And the word mental derailment, well, there's some words that as a professional we are not supposed to use. But we don't even use the word mental disorder or mental illness. So we should use mental disorder or mental health challenge. So that we are not stigmatizing. We are trying to remove stigmatization, because mental health is like, it's a challenge, like somebody having a headache. So why do we now need to now paint it in a black form? But we are not denying the fact that, yes, like I told you yesterday, my stress level has increased. If I get back from work and I want to sleep and I begin to remember every of those actions that happened at work. So thank you so much for that contribution. Genes, hereditary, and environment, all these are contributor factors to our mental health well-being. Yes, sir.
All right. So thank you for such an insightful response. So trying to find out if we have any other.
Yeah, my hand is up. I'm not sure if you're seeing it.
Dr. Park. All right, please go ahead.
Yeah, thank you very much, Prof. That was very insightful. So my name is Frank, and everything you said here was very informative. Actually, you took the word out of my mouth. When I heard the word in derangement, I know that was a word we used back home. I was a little bit worried, but you corrected it. It's just called mental challenges or other things that could be used, where I am now doing what they call the second missionary journey. I saw a lot of students who have a lot of mental challenges, and some of them came out of that environment that they saw from their generation of their own parents. So some of them end up smoking. They thought that smoking weed or whatever is normal. So they woke up, they just slept from hangover, overnight drunk, woke up, go to the bathroom, come up smoking. After smoking, the next thing what are they smoking? They're smoking hemp. The next thing they went up was liquor, no food. So all those things gonna go into degenerating their body and everything. So it was very informative, and again, it ended up being, now if somebody used that word derangement, they sue you here. They sue you. Not only suing you, If you're a professional, you're going to lose your license, you're going to lose everything. So there is a better word being used to kind of qualify them. And also, I also want to say, this is a kind of seminar that we need here. And sometimes it brings us closer to what we are actually scholarly, So thank you very much, and I appreciate. And the moderator, this is the second time I've met you. You're doing a good job too.
Oh, thank you. Thank you so much, sir. All right. I think, yeah, that would be
Can I
our
speak?
last question.
Do you hear me?
Yeah, I can hear you. So,
Oh, okay.
yeah,
My name
please go
my
ahead.
name is Dr. Sheila Basapo Moyo, and I want to share with you what I have done here in St. Louis in the United States regarding mental health. There is an organization called the Independence Center, and it's based on the club concept. The mission of the Independence Center in St. Louis is to improve the quality of life for the severely mentally challenged. And at the center, the people that attend our clients have to be referred by their doctor, and they run the center. It has a computer section, it has a canteen, it has a section where people are made interns. Interns, they go and work for a period of time at different businesses so they can get job experience. I have taught health education classes at the Independence Center. I've also participated in drama classes where the clients put on plays and they write the plays themselves. So I just wanted to just mention that there is such an organization that caters to people with mental illness. I agree with you. I think that all of us have some degree of mental challenges. But I've talked to some of the clients there and they really enjoy going there because they find people who understand them. It's run by counselors. And so I would encourage you all, if you have an opportunity, to go online and look up the Independence Center. I know it's been a great experience for me to be a part of it. Thank you.
Right. Doctor, do you have anything to say on that?
Oh, yes. One of the issues, is like, well, we were talking about Africanization. One of the functions or responsibility of either a counselor or a mental health therapist is to provide resources. So she has provided that resource. It can, at no cost. So what my main concern, we are looking at Africanization, we are looking at Africa. I appreciate what you have said, ma'am. And I've noted it here. I'll check it online. How do we get some of these resources in Africa? That's a question I'm leaving for every one of us to ponder over. I don't know when we are going to meet again. I don't know whether we are taking this forward from today, but how do we make these resources available in Africa? Thank you.
Deep.
That was a powerful question, right? Just like you said from the beginning, that so that this session would not just be a talk show, right? It has to be followed on or followed upon with tangible action. And I think a way for that action to come to life is a question that you have left us with. Such an interesting question. How do we make these resources available in Africa for Africans, right? And I think, just like you had rightly said, I feel personally, I don't have data now, but you showed us that I think over 150 million Africans, have one mental health challenge or the other. I feel that Africans need more, need mental health support than any other part of the continent. I mean, any other continents, the reason is because just like you were talking about, the different challenges that we go through or that come at us every day of our lives. I mean, you are in North Carolina, that was just a fraction, of what an average African experience on a day to day. So we need these resources here in Africa. How can we bring or make them available in Africa and even contextualize them, to our own realities and experiences? So thank you so much, Dr. Oluyemi, for the time and also for the amazing session. Thank you so much. So I think I want to hand over the mic to Professor Stella for the closing. Yeah.
Yeah, please, to piggy on that, what you said, I think Dr. Chima hand was up too. I think this could be a challenge for us as IIS, and also to ask Professor Oluyemi, how can we help in without knowing much, because I don't know much about some of these policies back home in Africa. How can we actually make this impact? Because as we are talking, I remember many years ago, please excuse me if you hear some noise, I'm just driving. I noticed, I see where there was a group of, now going back, Africa is so huge, then I want to bring it down to a little bit Nigeria, some part of eastern side, where either the church people or whatever will gather these people who are mentally challenged and line them up and, beating them up, flogging them. And sometimes they'll be in a chain, in line, beating drum and collecting money. After which they will take them to a particular facility and either feed them or don't feed them, or beating them, claiming that they're praying or doing something to cure them. How can we get away from that and actually help in diagnosing and facilitating for their recovery? How can we here help in shaping a policy or assisting those who are policymakers and seeing that they get away from such practices and go into the real thing that to help them? Could be some medication also some of them will take. We see here that in a psychiatric hospital, some people claim they are okay when you know that they're not okay. And sometimes medication helps with controlling them. And you see, if they don't take that medication, they will go off. So what do you think that we can do in our own little help to help these people back home? Thank you.
I'll make very brief because of time. One, sometimes we have a misconception that mental health is all about the severe issues. Like I mentioned, stress, a lot of stress, anxiety, phobia, panic attacks are also, but the aggravated ones. What I want to suggest, and I don't know whether, what I just want to suggest is that in our own little way, we can say, okay, maybe this group, I don't know the modus operandi, like, okay, you want to have mental health awareness, want to increase mental health awareness, want to educate people, want to talk to legislators and all that on how policies can be formed. Every individual have a right to choose where they want to have their treatment. So the little that I know that we can do, or that I think, not that I do, is increase our level of awareness, organize seminars like this, get stakeholders, spiritual leaders, traditional leaders that will have influence on the people. And they will be able to cascade the information down to the society. I don't want to talk about the government or politicians. I have my reservations for them. But in conclusion, we need to increase the level of awareness and let them know that empirically there are solutions, or there could be help. Don't let me use the word solution. There could be help. Thank you, sir.
Right. I think we have 3 minutes to 1. I think okay, we can just give Dr. Chima. I think I saw his hand raised.
Yeah.
Dr. Chima, please.
Yes. Now I have lowered my hand. I want to I want to advise that in line with Africanization, we have to do something about those who are studying mental health. I mean, those who are studying and those who are teaching. I'm not in that area, but I'm interested in that area. Years back, my cousin, we were discussing, he came back from one class. He said that all of us, we had mental issue. I said, no, in Nigerian broken engine, me, I no get mental issue. And he said that the instructor was saying that when you lock your door, you just come back and start shaking, trying to open it. That's a mental health issue. So using that, but I'm trying to say that those who are involved in research involving mental health areas should maybe come together within the IIASM periscope. What are the instruments? We just gather the instruments that people have used or that have been validated for use in mental health studies. Let us just gather them so that people who are involved in mental health will look at them. Maybe we constitute a meeting where stakeholders will actually talk about standardizing these instruments in various areas. So that will be a good place to go, I believe. Thank you.
Awesome. I can see Dr. Oluyemi already throwing some claps there. Thank you for sharing that, Dr. Chima. Yeah, so it's just a few seconds to 1 o'clock, and I think today's session on the Africanization series, part 4, has been an insightful one yet again, like I mentioned the other time. So, and it has, from the question that Dr. Oluyemi threw at us, I think this is, giving all of us some level of responsibility to take. And the question is, how do we make all of these resources available in Africa? And I think that relates to what Dr. Chima also, mentioned about standardizing all of the instruments or the solutions available so that we know what to, administer to what. Yeah, thank you so much, everyone, for joining us for this session or this part of the Africanization series. See you next time. Next month, November. Yeah, next month, November for the part 5. Yeah. Goodbye, everyone.